A parent said to me today, my child isn't buying into the coping skills that they're learning in therapy. And here's what I said to her. It's not that your child isn't buying into what they're learning. They can't generalize those skills they're learning in therapy outside of the therapy room, which is why therapy is not a recommended treatment for kids with ADHD and why parent training is the evidence-based recommended treatment. Kids with ADHD live in the moment, so we have to teach them in the moment. When a child goes to a therapist and the therapist teaches them, coping skills, and then they're expected to use it 4 days later, well, that is typically outside of the child's time horizon. That's too far of a distance between when they learned it and when it would be applied. And as we know, kids with ADHD tend to not apply things that they learned several weeks ago. Or they might seem to make the same mistake over and over, which is not actually making the same mistake over and over. It's that they're not recalling the past information or the emotions associated with that past experience and applying that to the present. Now, I do want to explain, I'm a licensed therapist. I am not anti-therapy by any means, but there's a reason why therapy is not a recommended treatment for kids with ADHD, because there's no evidence that it helps them consistently with ADHD-related challenges. So if you're looking to follow the American Academy of Pediatrics evidence-based treatment recommendations for ADHD, here's what they are. For children under 6, it's to start with parent behavior training, followed by the use of methylphenidate if necessary. For children 6 and up, the recommendation is parent training in conjunction with medication management. I provide parent training through the ADHD Dude membership site, and Scaffolding Better Behavior, my parent behavior training program, is actually the first one ever designed specifically for parents of kids with ADHD. Here's what I always tell parents. Number one, we are running to therapists too quickly in our culture right now. But here's the other thing. I never want any child's relationship with therapy to be toxified because they were forced to go when they were younger. So if you think your child might benefit from therapy with the understanding it's not going to help with the ADHD piece, you can say to them, do you think it might be helpful to talk to somebody? And if so, do they prefer to talk to a man or a woman? If they say yes, then great. Find somebody who they click with. Remember, who you like might not be who connects the best with them, so keep that in mind. But most importantly, we don't want kids to have a negative experience in therapy, because when they're older and they might need it one day, we don't want them not to go because they have this memory of being forced to go when they were younger and it being a negative experience. I hope this is helpful. I'll speak to you soon. Take care.